Morning, everyone. My name is Jose Cano here at Chevy Cadillac in Delavan. Welcome, Kunes Car Combos. Today, we're going to go see Sarah Nicholas from Open Arms in Elkhorn in this 2024 Chevy Blazer. So tell us about a little bit of the history about how Open Arms started.
Yeah, no, it's quite amazing when you think about like the power of one person. So in 2011, a beloved priest from the Fontana area, Father Dan Sanders, he was getting the Citizen of the Year award from the Weston Chamber of Commerce. And he shows up and he accepts his award because they had done a lot of things in the St. Benedict's parish. Anyways, he said out, like the first time out in public, you know, out of all the things that we've started and all the things that we've done with the community, I wish we would have started a free medical clinic. Mm-hmm. And just those words coming out to the ears in that room, it was so remarkable that people said, well, Father, let's do it. And at the time, he was getting transferred to another church community north of Milwaukee, in Mequon-Thiensville, and he says, oh, no, you guys do this. And they're like, oh, no, Father, we need you. And so he literally would come back that whole summer of 2011, sit around a kitchen table with people who were interested in getting this started, looked at other free clinics in the state, in the country. Turns out free medical clinics have been around for centuries. Every community has, pretty much every county in Wisconsin has one. And so they would go and look and see how they got it started. And this community effort just started, and it was like fire, right? Every retired nurse learned about this. Our beloved Carla Tildall, who just recently passed away, she had heard about this, and she's like, I know nurses. I know how we can get this together. And then Dr. Pisano, his name came up as a potential medical director. And so Father Dan would call, and Bob said yes. And so like one person after another just said yes. And they learned about what it would take. So Walworth County never had a free medical clinic. They don't have a community clinic. They don't have any sliding scale. So if somebody didn't have health insurance, they'd have to go to the emergency room or pay out of pocket to the doctor and stuff. Well, that's fine once in a while, but bills add up. And then when you have medications, you can't pay for those. And so you go without. And so the need was really great. And actually, when they did the study in 2011, the Walworth County Public Health actually was doing data and how many people were uninsured, because access to medical care and access to dental care were the top two priority lists for the county at that time. And so these two things were aligning, like this must be the time. And so really that's how the mission got started, and volunteers sat around the table, looked at what do we need to do. All of a sudden, Judy Johnson, I call her my matriarch of the clinic because she has a heart of gold and she will ask everybody. In fact, she would go to Greg Kunes and ask him for a sponsorship. And when I asked for a meeting with him, he's like, are you bringing the old lady with you? And I was like, well, no, I just want to meet you. And so anyways, she was so good at asking people to support this mission because she was just on fire, knowing that the need was so great. And she actually wrote our first grant to Kikkoman Food Foundation for $15,000 to pay for rent of the facility that they had found, because there were 12 different action committees working for location, for fundraising, for volunteers, for all the different things, right? And so we found a cute little, well, I was not part of this at that time, but they found a place right across from Elkhorn High School, and it was in the strip mall right by Breber Music and VIP Services. I don't know if you're familiar with that.
Yep.
Anyways, cute little office. It was 1,800 square feet. There were 4 medical exam rooms. There was a little lab. There was a little waiting room. Like everything was like perfect, right, to get this started. And that foundation grant helped support the rent for a full year. Because there were a lot of people in the community who did not think, A, Walworth County needed a free clinic, B, that these group of do-gooders were going to make this actually sustainable. And so, people were hesitant. And it had, this 2011 time period, 2012, this is when the Affordable Care Act was discussed. And everybody, you know, that legislation had passed, but it hadn't been implemented yet. So again, everybody thought, oh, everybody's going to have health insurance through Obamacare, right? But yeah, the little engine that could just kept on showing up, and donors were coming together, and volunteers were coming together. And now, how I even got involved is I just showed up. My husband got transferred to Wisconsin. We were living in Connecticut at the time. I'm born and raised in Green Bay. I went to school in Madison, but literally I had no idea what Walworth County was. I didn't even know Lake Geneva. I know, shame on me, but I didn't. And so like we moved here in November 1st, 2011. I'm 9 months pregnant with my second baby. I have no idea where. I feel like we landed, like all the cornfields. Like I felt like I landed in the middle of the Twilight Zone because I couldn't understand. I went to the library to learn about what Walworth County was like, and I'm like, oh, farming. I'm like, oh, tourism. Oh, manufacturing. I'm like, oh. I mean, like I'm a geek anyways, and the library had a free like children's program for my 4-year-old, so it was like a win-win in that point. But anyway, so that's how I started figuring this out, and then I just needed to get involved. And I have my master's in public health, and I've been working in nonprofits for at least 20 years before I even got here. So I'm like, I gotta be part of something. Where is that something?
Yeah.
And sure enough, my pastor, Father Oriel at St. Patrick's here in Elkhorn, I learned that he was on the founding board of directors, and I'm like, oh, okay, so you know what Open Arms is, because I had heard about it. And he's like, oh yeah. I go, I need to get involved. How? And he connected me to Father Dan. And so I met him on October 22nd of 2012. And he's telling me how, the story I just told you, announced the vision, got these volunteers, stakeholders, grants. Dean Clinic was closing their office, and volunteers went and picked up all their medical equipment. So every exam table and tongue depressor, like everything for a clinic. And that's just how it started coming. People were coming together with the resources that they had.
Right.
And then there was even a group of folks who were looking at what would the enrollment criteria be? Like, how do you use donors' resources, local resources effectively? And so they had really identified, narrowed down. You had to live or work in Walworth County. No health insurance. There were still many people that did not. In fact, there were about 10,000 people who did not have health insurance at that time, and that's statistics, like and census data and stuff. And then the household income of 200% of the federal poverty level. So like for now at the time, for a family of 4, that's about 24. Now that would probably be closer to about $32,000 a year. Okay. Which, like houses, cars, like that's not a lot of money. And so if you have a chronic disease like diabetes or hypertension or asthma, you can't pay for that medicine. And so anyways, so that was the criteria. And Father Dan's telling me this, and I'm bawling, and I'm like, oh my gosh. I can't get this. When I was in college, my freshman year of college, when you're sitting around with like pizza and beer and you're just like talking and like, well, what'd you do with $1 million? And you're like 18 years old. And I actually said out of my mouth at that time, I wanted to start a clinic. I said it. Like, I'd love to start a clinic. Like, I just feel like people need help connecting, right? Like, I certainly don't know everything, but I know a little bit, and I am so curious, and so I always want to figure it out. And so we can be a connector place of health or jobs or legal assistance or just, like those basic things. That would be awesome. And here it is, 20 years later, and I'm like asked to be part of this clinic that's getting going. And so, and literally 2 weeks later, we enrolled our first patient. So that was November 7th in 2012. And I'm a volunteer. We're all volunteers. We're enrolling patients, and we're like, and we didn't know actually if we needed to call law enforcement because there would be like a big like a rush to like all these people who wanted to come to the clinic, or if anybody would show up, because like it was a slow launch. Like just the social service agencies knew about it, and a couple people. But sure enough, that first day, November 7th, we enrolled 15 people.
15 people. Wow.
And to hear the stories of, oh my gosh, I remember this one woman. She was 56 years old, white, elderly, like just really weathered. Like she had had a hard life.
Mm-hmm.
And when I said, I'm so glad that you're here, you qualify for our services because we did an interview. Your first appointment is December 6th, and we'll be able to give you your insulin. She and I sat there for long minutes crying. She's like, well, do you need anything? I go, no, you qualify for our services, it's free.
Mm-hmm.
And she's like, even my medicine? I said, yes.
Mm-hmm.
We were just weeping because it was like that magical moment
Right.
of that's exactly why we were there.
Right.
So anyways, so we enrolled for the whole month of November, every Wednesday for 5 hours with a group of volunteers that were dynamic and wonderful. And then Dr. Pisano is starting the medical team for December 6th. So every Wednesday, 5 hours enrollment, every Thursday, 5 hours treatment. And that's how we started.
Wow.
And sure enough, everything is free because all of the providers, all of my doctors and nurses, all of those folks who are doing the direct care are volunteering their time. Like they're still licensed, credentialed, board certified, all the things that you need to be practicing healthcare.
Right.
They were, and we, because we were a free medical clinic, as part of our articles of incorporation and our corporation papers and everything like that. And then the Wisconsin Association of Free and Charitable Clinics hadn't been organized yet,
Mm-hmm.
but the state of Wisconsin had a statute that if you are a licensed professional volunteering your time, they at a free clinic or a school and some of these other environments, you can get the state's malpractice insurance coverage for you at no cost. So, you don't want a doctor who's worked their whole life to become a doctor and then have one lawsuit and ruin it all because you're a good Samaritan, right?
Right.
So that was absolutely critical that the state had that program for free clinics to exist with a volunteer provider base. That's just how, Dr. Pisano came. He's a hospitalist at Mercy Hospital, and so he would come every on the first Thursday, and then he works every other week at the hospital. So on his week that he's on, his colleague, Dr. Dina Courier, was his opposite. So the two of them would do every other week, and so we would do treatment every other week, and 10 patients at a time, and then pretty soon we were 3 months, we're booked out 3 months,
Mm-hmm.
and we're like, oh my gosh, we need more help. So Dr. Pisano asked for more hospitalists. Other doctors were hearing about this, and they started coming on, and so we had, we opened up a second day of treatment, and then more people needed refills, medication refills, and so it was very clear that we needed a bigger waiting room, and at the same time, so we get through 2012, things are running. 2013, the Wisconsin Dental Association had identified Walworth County as a dental shortage area and actually organized what's called a Mission of Mercy event. It's a 2-day free dental clinic. And dentists and hygienists, all these dental professionals from all over the country literally came to Lake Geneva in Badger High School. They remodified the whole school. I'm not joking. The whole lower half of that school into what was like a MASH unit for dental care.
Wow.
And over 1,000 people got free dental care for that 2-day event. And this is not just like cleanings. This was your root canal, your extractions, your x-rays, dentures. One of my first patients that we had seen at the clinic, she's a waitress and she had no teeth. And she's like, I'm never gonna make a living. Like, I am a waitress. Smile is my commodity, and I need help. And Bob Dillman, who is a founding board member and a beloved dentist here in Lake Geneva, he said, I gave him a call. I'm like, is there anything we can do to help Rachel? And he said, you know what? Mission of Mercy is in a couple weeks. I will carve out a spot so she can get molded for dentures. Oh my God! I have a picture of her with her full smile and this beautiful dentures. And I don't know where she is in the world today, but oh my gosh, talk about changing your life.
She's probably doing commercials.
She may, probably because she's probably got the best smile now, like in Walworth County. But I just those are the moments of connections. I didn't have a dental clinic, but I had somebody who knew how to get this person the help. And so I'm like, Dr. Dillman, we really need to add dental services to Open Arms. And he's like, Sarah, it is so expensive. You'll never, ever convince anybody to do free dental care. I'm like, game on.
Yeah, challenge accepted.
Challenge accepted. So from, really that day, anytime anybody talked about dental, like a dentist was closing their office, do you want their equipment? And I would say yes. And Hub's like, Cyril, what are you going to do with it? Well, we were in the strip mall right next to VIP Services, and they had a storage unit.
Oh.
And I said,
Nice.
well, Cindy Simonson is a fellow Rotarian with me, and I'm like, Cindy, if I were to, let's say, accept a dental chair, and I had nowhere to put it, would you have space? And she goes, yeah. So she gave us in-kind space.
Wow.
And for about a year and a half, we held on to all this equipment. I didn't even know what I was saying yes to, which I've learned since then, but because we did have to throw away stuff. But that really said, okay, I need more space. We need more space.
Right.
The people in this county need dental services. And it continues every 5 years. It's on the top list of needs from the Walworth County Public Health Assessments, access to dental care. So that was really how we got that going. But, and now the building that we just drove away from,
Yep.
that was a former Aurora clinic. Aurora was, that building was built by Dr. Thies, who's an Aurora family medicine doc. And Dr. Thies' friend was Dr. McGill, and he's a dentist. And they bought that whole campus property together as a two-unit subdivision, basically. So Dr. McGill and Dr. Thies, they had the dental clinic and the medical clinic, and then Aurora, became a partner, and so Aurora was renting that building, and then Aurora built a new building down the road, and it had a for sale sign on it. And I am, now at this time, that 2015, so this was 2014, that I'm like, okay, we opened in 2012. We're growing patients, right? We have a patient population now. We're doing 2 full medical clinic days a week. We're still doing enrollment every Wednesday, walk-in only, just for Walworth County residents, if you live or work in Walworth County, because we know a lot of people live in like Burlington or Whitewater, in the surrounding areas, and this is where their primary work is. So if they had a pay stub that showed that, and we would do their calculations based on their income, every year to make sure that they qualify for our services.
Do they need to make an appointment?
Oh, do they have to make an appointment? No. So, well, yes, actually, they do. So now the way we work is the enrollment process. Because of the we used to have it where the enrollment process to become a patient was walk-in only. Okay. Every Wednesday you walk in, you bring your pay stubs, you bring a piece of mail that shows where you live. If you don't live in Walworth County, your pay stubs would be, the identifier of Walworth County, and then a photo ID. And the photo ID just has to be, whether it's government issued, like from a home country, because we do have a lot of folks who are foreign born, and so they'll have their passports or some identifier from their home country, or like for students, they'll have a school ID, So in the beginning, we had a lot of folks who were jail inmates at Huberdorm, and so they had their jail ID. So something that had their name, their legal name, and a picture. So photo ID, piece of mail, and pay stubs. So that was their income. Because of the pandemic, we couldn't do walk-in, and that was really, and so we had to modify. So we did change in 2020, where we'd have now on our website at openarmsfreeclinic.org, it is patient centered. So right when you get to the main homepage, you can see register now in English or Spanish. And so this 24/7 registration application still can happen. We still do an interview with each of the, so we'll schedule an interview appointment with the person, just to make sure that we want to make sure that we're the right healthcare for them, right? If they have complex cancer or some other medical, we're primary care, like primary medical care. We'd like to do more prevention. We like to do much more maintenance. We'd like to do much more control. We can do diagnostics, but if it is advanced care, that's really outside of our scope, especially because we're utilizing volunteers. And they need much more acute attention. So we want to make sure that we're the right care for them. We also want to make sure that if this is like an urgent need, that like shortness of breath, don't walk in for intake if you have shortness of breath. Go to the emergency room. We can do your follow-up care. That would be fine. And then it's like, again, right place, right care, right time, that kind of thing. So that's why we do the interview. And plus, we want to know what else is burdensome. Like, are they having a food shortage? I mean, food insecurity is really, really high. Housing insecurity is really, really high. We know transportation is difficult. So we also will connect them to other resources for those basic needs.
Okay.
We offer the free Uber rides for people who don't have transportation. We connect the Walworth County Food and Diaper Bank is right next to us, and so we'll have emergency food bags for them so they can get started on that. So anyways, we want to make sure that we connect them. After that, then it is scheduled medical appointments, because again, the doctors are volunteers. Some come twice a week, some come once a week, some come once a month, some come once a quarter, because we have about 20 different medical providers that will come up. But if somebody just like, I have a sore throat, I want to go to the free clinic because I don't have insurance, we're not the right place for that, because all of those appointments for those docs have already been booked. We don't have same day appointments openings. So it's not a walk-in clinic. It's not an urgent care clinic. It is truly your medical home if you cannot get health insurance. And we do such a great job trying to help people. If they qualify for Medicaid, the state insurance program, we'll actually help them do that application. If during open enrollment for the marketplace, I have an insurance agent who actually comes in to the clinic to help them get health insurance. Sometimes they're just like, they're not well enough to work, and they haven't gotten enough medical documentation for Social Security or disability, so we're that in between. So we do that. For some people, we are their medical home. There's just a number of different scenarios but we see people of all ages. Births, it's really wonderful. Our dental program that got going really full-fledged when we moved into our new building. Of course, Mr. Kunes helped us to do that. It was really nice. And we had our first 2 dental chairs. Again, all the things that I had in the storage got put in there. And at that point, I started. We added behavioral health services. Our medical program grew because we had more space. We had more medical exam rooms. Our medication program worked, and again, why it's free to our patients is because we leverage the abundance that's already in health systems. Like pharmaceutical companies, so much money, and they have so much product, and they, if something, there's just got to be a way, right? And sure enough, as a free clinic, what we were able to do is partner with these national dispensary groups. So we have a lot of our medicine comes from a place called Dispensary of Hope.
How can you get involved in Open Arms?
Sure. Well, folks from all different ages and genders and backgrounds and all the different have found a way to touch Open Arms. Obviously, volunteering is really important. We have over 1,000 volunteers that have come through of all ages. I mean, high school students, college students, actively working, newly retired. So a lot of wisdom. So volunteering if you have the time, or there's a pursuit, of some type of service motivation. We're 100% funded by grants and donations. So folks who give a monthly gift, for example, right on our website, it just takes it out of your bank account. Some folks have family foundations, and so they, part of having a foundation, you do have to make annual contributions. I would say that we're a pretty good investment of using that money really wisely and stretching the dollar. Pretty much every dollar that is given to us, we're able to do $10 worth of medicine free for the patients because we're leveraging all these other abundances in the healthcare system. Word of mouth. Folks have, it's interesting when we ask new patients, how did you hear about us? It's usually a family or friend that they trust. And they say, you know what, I heard this place can help you. Doesn't cost you anything to look into it.
Right.
You just, maybe your time. But give them a call, see if maybe they can help. And if they can't, they'll be sure to help navigate. So our friends and our families have really been great at providing that testimony, that word of mouth, that trust, that healthcare can actually be focused on health and wellness, not just the sick. And so it's our family and friends. And Kunes has this big, prayer is everything. Praying, giving a prayer or saying a prayer, offering up a prayer, that the resources are always met, that those who can help do, and those who need the help can find us at the right time so that they can really live their purpose. And that's the part that I really get emotional about, because even though we're a community-based organization, we're not a faith-based organization. Yes, we started by a Catholic priest, but people of all faiths and no faiths have helped us, have been received care from us. But the spirit is so strong.
It's contagious.
It is, and it's so joyful.
Yeah.
I mean, you caught the spirit a little bit. I mean, how you were invited to consider being on the board of directors. Why'd you say yes?
Just helping other people, just that feeling to help other people.
It's nice to be asked to help somebody when you have that ability to help, right?
Yep.
So my only compensation for you, Jose, is joy. Are you getting a little piece of joy?
Oh yeah.
All right, good.
Oh yeah.
I always say, it's your time, it's your choice. It's, time is such a precious commodity, but if you use it to do something really purposeful and meaningful, and you're touching another human's life in just that amount of time, there's so much joy that you can't put a price tag on it.
Right. I agree.
Yeah. With those grants and donations, yes, people can make those private gifts, and yes, I can write a grant, to a foundation. Those are all opportunities that exist. But we really try to do only 2 major fundraisers a year. So June 4th this year is our golf outing. It's our 11th annual golf outing. Our golf outing is on the first Tuesday of June. We've been at Hawksview for all 11 years. Always sell out. Kunes is such a great supporter of our events because we can share our mission in a really low touch point, right? For those who can take a half day off of work and golf with their colleagues, golf with their friends. About a third of every event participant is brand new to the organization. They've never heard about us before, and here's our opportunity to build friends, right? And so our golf outing is that first Tuesday of the month first Tuesday of June every year. And then our birthday gala, and why I call it that, is the first Friday of December. And it's because that's when that clinic really was birthed. Our first patient was treated on December 6th of 2012. And so to birth a mission is like a birthday, so we celebrate it.
Yep.
And now we've celebrated, over 10,000 patients getting care because the community has come together with their time or their resources in some capacity, and it really is beautiful. It's so fun.
Speaking of donations and sponsorships for the golf outing,
yeah,
I have a little surprise for you.
No kidding.
I made a few phone calls and a couple of business partners and business.
Oh my gosh! Oh my, yeah, a few?
Yeah, so
wow!
you can read those out.
Oh my gosh. Jose, you did this.
Yep.
You are giving us, with your friends here, a total of $1,200 in donations.
Mm-hmm.
So Betsy at BCT Services, oh my gosh, Betsy, thank you. Kunes, I'm gonna cry. Coney Chevy Cadillac Delavan, thank you. Corey at Corey's Auto Care. Oh my gosh, thank you. Luis and Berenice at Oficina de Moto Servicio. Did I say that right?
Yep. Servicios.
Servicios Delavan. Oh my gosh. Well, do you know, Jose? First of all, thank you.
Mm-hmm.
Because all you did is ask, right?
Yep.
Just like we asked you to be part of the board, you asked your friends, people that you know,
Yep.
to support us. Well, this $1,200 is actually equates to $12,000 worth of medicine.
Wow.
So all these folks just gave us $12,000 worth of medicine
That's awesome.
to help our community stay healthy and well. Thank you.
You're very welcome.
Oh my gosh, thank you. This has been fun.
Yeah.
You want to go for another ride? I mean, like, it's such a nice day on a country
It
road
is.
in Walworth County.
Yeah. It is.
Well, thank you again for everything that you're doing and sharing the good word.
You're very welcome.
When people know, you don't know what you don't know, right?
That's right.
And people don't know what
Well,
to
you
even
gotta ask.
You don't even know how to ask a question. Like, how do I get involved with something really purposeful, really meaningful, something that's going to make a big difference? Like, we all have finite time on this earth, right?
Right.
We might as well use it and do something really
Good.
awesome.
Something positive.
Right. So a lot of good is happening at Open Arms Free Clinic.
That's good.
And we've got some big plans. We've got a really great future of expanding our behavioral health services, expanding our medications services, some
Sorry.
things.
So besides the healthcare and dental, what other services do you provide?
Yeah. So behavioral health, the counseling, the one-on-one counseling is really, really important for people, certainly in the pandemic. People are struggling with a lot of stress and anxiety. Situational, but sometimes it's clinical too. And they need to have not only the talk therapy with a bilingual counselor, or an English-speaking counselor, or family counselor, or a youth counselor. We have those, right? But they can also get the medication assistance there too. So total, all of our service, we have primary medical care as our core. So everybody gets that first medical visit. Dental care, general dental care. We have our behavioral health services. We have that medication assistance, so that they can get their free medicines right at our property. And we get that from the abundance, again, from the pharmaceutical companies. And then lab services and the referrals to specialists and other external care. I mean, just this year, because we have a partnership with ABC for Health Legal Services, we've been able to reduce over $200,000 worth of medical debt. Because people go to these hospitals, right, and they have these urgent things happen, and then they get these huge bills, and they don't know that they could qualify for other programs to reduce that debt. And so we've been able to be a connector to help reduce medical debt. We've been able to be a connector with Uber Health Services to get people, transportation services to our appointments. We've been able to give vaccines for both flu and COVID. And so that's been real. And now we're doing so much more extension into the community. Our medical outreach is a nurse practitioner is an Ask a Doc at the community space in Whitewater, at Lake Lawn. With the people who work at Lake Lawn, you don't have time to get off of work, but yet they have high blood pressure. Could we get a blood pressure check? Could we get a diabetes check? We're doing that. Bird's Eye, other partners, and libraries, doing a blood pressure club at the libraries to just reduce heart disease here in Walworth County. Heart disease, the rate here is 3 times higher in the county compared to the rest of the state. So clearly we need to do some education. We need to provide some resources. And then the dental outreach, we have a mobile dental program called Seal Smile. We're in 33 schools in Walworth County doing dental screenings on the children, fluoride treatment to protect their teeth, and then also sealants. And this is all free. All the parents have to do is sign a consent form. And we go right into the school, set it up, and work with the schools to take care. And last year, we took care of 3,000 children.
Wow.
And 30% of those children needed a dental home, and they didn't know about our dental program. Last thing, and this is one of my favorite things, is we are a workforce development placement for Gateway Technical College, Marquette Dental School, nursing programs, pharmacy programs, social work programs. So our goal is to build healthcare workers of the future that remember the human. All the tools like AI and all the systems that are coming out, they're going to be great. They really will help. But if we don't remember that there's the human on the other side of this tool, we forgot everything.
Right.
So we're developing the compassionate environment where those who've done this trade, done this work for decades, can now teach the younglings coming through on how to remember the human in healthcare. So I really feel like we're, the campus that we've developed based on community support is really I hope, will change healthcare for the future.
Nice.
That's my story.
Well,
I kind of like it.
Yeah.
I kind of enjoy doing this. Can you tell?
Yeah. Well, thanks everyone. Open Arms Free Clinic in Elkhorn. Where can they visit
On the website.
on the website? Yep.
Yeah, openarmsfreeclinic.org is the website, and we're on Facebook, Instagram. We have a wonderful YouTube channel, so you can get connected to us that way.
Got
Thank
phone number?
262-379-1401. 262-379-1401. And
Alrighty.
yeah, so